More aid has arrived in West Africa to help fight Ebola. A cargo plane carrying medical equipment, water, and food landed in Guinea. A shipment of ambulances is also scheduled. The World Health Organization has issued new guidelines on protective gear. They're now recommending that health workers wear 2 pairs of gloves and cover their mouths, eyes, and nose to keep out contaminated fluids. CDC officials demonstrated Ebola screening measures at Dulles Airport here in the Washington, D.C. area. Officials explained the 3-stage process used to screen travelers from Ebola-plagued countries. And a judge has rejected a bid to restrict the movement of a U.S. nurse who treated Ebola patients. The nurse defied a state quarantine for medical workers returning from West Africa, but because she's not showing symptoms, the judge says she's not infectious. Health experts from all over the Americas are agreeing to work together if there is an Ebola outbreak in the region. CCTV's Michael Voss reports now from Havana.
The only reported cases of Ebola in the Americas so far are in the United States, which has one of the world's most sophisticated healthcare systems. But not everyone in the region has the resources or know-how to cope. Nearly 300 health experts from across the Americas are in Havana this week to look for ways to improve coordination and support. Many of the small Caribbean nations feel particularly vulnerable.
As individual nations, I think it would be very difficult for any one country in the Caribbean to deal with this sort of threat, which is why CARICOM and CARF, the Caribbean Public Health Agency, have been trying to collaborate and coordinate at regional level.
The United States has no diplomatic relations with Cuba and still imposes a trade embargo, but combating this killer disease takes priority over politics.
Good, productive meeting, indeed, yes. Have a diagnosis of what's going on in each of the countries that will allow us to prepare for an improved plan overall for the region.
One area of concern raised at this meeting is access to specialized equipment and drugs, in particular the modern biohazard suits needed to protect health workers.
We need to acquire the necessary personal protection equipment at preferential prices and create a regional reserve to distribute immediately in case of emergency.
More than 250 Cuban doctors and nurses are now working in West Africa, helping to contain the outbreak, which has already killed about 5,000 people. The Cuban medics received their training in makeshift facilities on the grounds of a medical institute on the outskirts of Havana. The training facilities at this hospital will now be open to others, and starting in early November, Cuba will offer Ebola safety courses for health teams from around the region. Michael Voss, CCTV, Havana.